I found. Well, the Yuletide campaign, which is Celebrate Responsibly, is all about helping Nigerians to stay safe and stay healthy during this Yuletide period. As you all know, we've seen a massive increase in COVID cases diagnosed across the country in the last 2 weeks. All states are reporting that. And we know that the Yuletide is associated with travel, with movement, with people gathering together, obviously, to celebrate Christmas, celebrate the end of the year. And the virus moves with people. Okay, so people meeting together in large numbers, traveling without masking or ensuring physical distancing, or again, without getting their vaccines, makes for all of the ingredients that you need to make for a really large surge of COVID cases now. Although we are not yet seeing a massive increase in hospitalized patients, but we are beginning to see that creep up, and it is therefore important that we protect ourselves by celebrating responsibly and staying healthy and COVID-free in this Yuletide period. Well, interestingly, I wasn't here in 2020. I was in Kenya in 2020, but it's the same picture. COVID has gone up here, cases in the last couple of weeks. I'm keeping an eye on the Kenyan situation, and it is going up like elsewhere, so same story. It's difficult to predict where the peak will end. As you know, the last wave we had was Delta, and Delta was new variant, highly transmissible, caused a lot of severe disease. But interestingly, for Nigeria, the peak wasn't as high as when we first encountered the virus brand new. Okay, but Omicron is a different variant. Already we know it's more transmissible than Delta. Whether it will cause more severe infections or cause more deaths, we still don't know. But we are watching the trajectory, and it is pretty steep, almost the same as the last wave. So where it will end depends on you and I and what we do to celebrate responsibly in this Yuletide season. Well, you know, all the pathogens don't, all the causes of this infectious disease, they don't sit down and draw up a rota. They don't say, oh, now COVID is around now, the rest of us should take a break. So we have other diseases that are typically prevalent at this time of the year, the dry season from November to about May. We've already seen cases of Lassa fever, so we are worried about Lassa fever, which is why we've written quite a bit of advisories, and we stepped up information for our healthcare professionals to protect themselves, and of course citizens. This is the season for cerebrospinal meningitis. We have also, especially for the high-burden states, stocked up on diagnostics and supplies they might need in case cases goes up, and of course ramp up the messaging for preparation in case something happens. So all the other diseases are not going to take a break because COVID is on the prowl. Well, that's what Celebrate Responsibly is all about. And all of the measures are still there. They have not really changed. I know that because of fatigue and all of that, people really would like to just see a magic bullet, something that will sort out COVID for good. But we are not there yet. So we have to depend on the tried and tested tools. Public health safety measures definitely work, regardless of the variant. If you mask properly and consistently, if you maintain physical distance, if you avoid overcrowding or ensure ventilation, you will protect yourself from COVID, just like you would for other respiratory pathogens. Another tool in our armamentarium to help prevent transmission of this virus in the population is vaccination. As we can see, developed countries are scrambling to give a third dose of the vaccine, a booster dose of the vaccine, because they see that even with the reduced effect of the vaccine on account of this variant, you can recover the benefit of the vaccine by giving booster doses. There's a mass vaccination campaign going on now for people in our population who are mostly unvaccinated. People need to go out and make use of every opportunity that has been afforded to get vaccinated. For those who have been vaccinated who's received their 2 doses of vaccine for more than 6 months like me, this is the time to go get a booster dose, because the government through the MPHCDA is also making available booster dose vaccination. So we have really all of the tools that everybody else is applying at this time to help mitigate the rise in cases. And of course, from the NCDC's perspective, we are working harder to step up surveillance. We are working really hard to increase access to testing through the deployment of rapid diagnostic tests that give you a result very quickly. As a matter of fact, I had one today, which thankfully was negative. So we want people to also make use of testing. You can walk into public labs. I know people pay more attention to the labs that test for travel, but they are not the only labs that test for COVID. You can walk into any of the public health laboratories in government centers and get tested. You can also, increasingly over the next few weeks, also access rapid diagnostic test kits from those centers as well. They are provided without charge if you go to a government facility. So we don't charge if you walk into the National Reference Lab in Gadua or any of the FCT facilities, for example, or to the Central Public Health Lab in Lagos. We don't charge. Or go to NIMA, you walk in and you get a test done. Well, we are trying to learn as much as we can, first of all, by sequencing, which is studying the genetic material or genetic makeup of the virus. We still see that we have a lot of Delta, but we've identified Omicron variants, and at the last count, there were about 19 of them now that we've identified in the country. So we haven't seen as much of a replacement of Delta as other people have reported, but as we continue to increase sequencing capacity and the number of samples that we sequence, we will be able to tell for sure whether we've seen a complete replacement of Delta with this new Omicron variant, or if actually we're having two waves, which is both a Delta wave and an Omicron wave. Well, the rate of testing is not where we want it to be. Okay, so we have rolled out rapid diagnostic tests in the last 4 to 6 weeks thereabouts. We've seen weeks where testing really went up due to uptake of rapid diagnostic tests. So about maybe week 46, 47. Then we saw a decline again. And we see in the past week that test numbers, obviously because we identify more cases, have started to go up. So we need people to test. Okay, we may not be able to test and do tens or 20s of thousands COVID tests per day, like in some places. But what we have now is the current testing capacity is not even being maximized. So people should test. I think part of the problem is people think that they need to be really sick before you test, but actually not. If you have even your usual respiratory symptoms now, you really should go and get a COVID test. Well, herd immunity doesn't really have to do with testing. It has to do with vaccination. And I'll be careful about, early in the pandemic, people talked a lot about herd immunity. People still talk about herd immunity, but, the virus is changing. We now have a very infectious version, which we are not sure will cause as much disease and death as the previous one. If you've got a really transmissible version like that is more transmissible than the ancestors. So actually it means you need to vaccinate a lot more people than that. So if the assumption was that we previously needed to achieve 70% coverage to achieve herd immunity, with the Omicron, we clearly need to vaccinate everybody, to get some traction. So what I think is us getting to herd immunity is dependent on vaccines being available and people taking the vaccines. Okay. Currently, we have a situation where vaccines available are not being sufficiently taken up. So we can't achieve herd immunity or as much protection as we would like to if people don't get vaccinated. And it doesn't matter whether you've got all the vaccines in store or in the pipeline. If people do not get vaccinated, we do not get protected. So that's the issue. So if we have people turning out in their hundreds of thousands on a daily basis to take up vaccines that are currently available and provide impetus for government and other partners to see, it looks like vaccines are going, we need to make more available, then we will get to the targets. So it's all entirely about people's willingness to receive vaccines, and of course that will be complemented by government making an effort to provide vaccines like they've done now.